Hello viewers, myself Dr. Vindoo and I am Senior Homeopathic Physician at Nation Care Homeo Clinic, HSR, Bangalore. Have you ever noticed a sudden pain below your rib on the backside of your body? Are you a person who don't drink proper water? Are you a person who are more prone to renal stones? Yes. So what exactly are these renal stones? Definitely a stone within your body is something that can panic you. For example, even a gallstone or the kidney stones. As we know, some people are prone to have these kidney stones. What exactly are these stones? Why are these formed within your body? We know kidney plays a major role in excreting the waste of the body. For example, a person who has a heavy intake of vitamin D or calcium or the calcium rich food, so slowly the excessive calcium is also being thrown away through the kidneys in the form of the urine. So once your body is unable to do that, slowly the urine gets concentrated. You don't drink proper water, the urine gets concentrated. Due to the urine which has the more calcium content, the calcium slowly started getting accumulated and gradually will form a stone. So there are types of stone, that is calcium urate and calcium phosphates. The type of diet that you have, based on that, the stones also can be formed. So what is this? Urinary system contains two kidneys and it has a ureter which connects, and after the ureter you have a single urinary bladder and urethra. So once this kidney stone formation starts in the kidney, sometimes without your knowledge also they can get dislodged and then they can come and fall away in the urine through your urethra, which could be painful process also. In some cases, this gradually in the kidney itself, the stones can accumulate, and there is a layer on layer calcium and calcium phosphates accumulation. Salts keeps happening, due to which the size of the kidney stone increases. And when you especially have a genetic background where your parents or your uncles or aunts might also have gone through a similar renal stones, then you also are carrying the tendency of the kidney stones. Obviously, your lifestyle also plays a major role. So when you don't drink proper water or fluid intake is less, or your dietary habits are very haphazard, junk eating habits, no proper sleep, you're not allowing the body to heal due to the excessive stress, physical or mental. So all these contributes, and this kidney stone slowly starts increasing. So it makes, a space where it starts growing. After that, you start developing a sudden colicky pain which is unbearable while you're trying to pass urine. There might be possible that there is a blood in the urine. Along with the passage, there might be a burning sensation once you're passing the urine, and the pain could also radiate to your abdomen along with the back pain, and the pain can also radiate towards your thighs. So this radiating pains indicates the renal stones. For some people, what happens is suddenly the kidney stone can get dislodged from the place, and they also settle and get stuck in the ureter, which they have to undergo emergency surgeries. Many people, based on the size of the kidneys, which is like 5 mm and above, tend to go for some laser treatments or blasting the stones. What exactly are you trying to do? We are trying to remove the existing stone which is there in the body. But are we trying to remove the tendency? Are we trying to remove the genetic factor which is causing the accumulation of the salts? Exactly no. So people go for multiple surgeries, but still they don't understand the beauty of homeopathy, where we can definitely help you to cure the tendency of the formation of the stone. The existing stone, see, it's not that every renal calculi we take up and we just advise for the homeopathic treatment. There is definitely a drawback. There might be some cases which might need an emergency surgeries, which might be obstructing the urine, and the urine is causing the swelling of the kidneys, which we call it as hydronephrosis. So we definitely have to go through a detailed case, and proper investigation has to be done to understand the condition of the patient, the reason why he developed this. Based on that, we decide if we can go ahead with the treatment or not. So once we start the homeopathic treatment, after considering all the scenarios, some time might be required to dissolve the existing stone. Along with that, we get rid of the tendency which you have been carrying, so that in future also you don't end up getting these kidney stones, because multiple times you suffer with this kidney stones. So So if you are going through this or you have any doubt, please immediately you can get an ultrasound abdomen through which we can find out the size of the stone. And if you feel that you have a similar complaint, you can reach out to us. We can, along with the dietary factors and some lifestyle changes, we will be able to cure your renal stone as well as the tendency.